Hi, so you want to get an amazing looking smile. You've heard that possibly veneers is a way to do this, but we don't really know too much about veneers. There's different types of veneers, there's loads of terminology around it, and this is all a little bit confusing. So in this video, I'm going to explain all the terminology, all the key things that you might want to consider when you're going down this route. I'll also show you a step-by-step process of how most people will carry out veneer treatment. Then I'll show you a step-by-step process on how I do it, because obviously I like to overcomplicate things because I get a little bit geeky about aesthetics. So first of all, let's go over some of the terminology. You might have heard about composite veneers and porcelain veneers. For this, let's jump to a computer and let's look at a real case. Okay, so here I've got a whole bunch of photos of a case that I did ages ago. We finished it kind of 2017. And I'm going to just show you the final photo. This is it, right? And what we can see here, that this tooth here and this tooth here, they are both porcelain teeth, okay? And actually this is an implant and this is a crown there. Now this tooth and this tooth are both composite veneers. Now, one way to think about both of these materials is that porcelain is like a glass material, okay? That's how it kind of feels like, that's the texture it's got, and composite is a bit more of a plastic. Now, you can see in this photo that the plastic and the porcelain kind of look similar, okay? And this is typical. On the day of doing the treatment, I think they both look fantastic. In fact, sometimes the composite can look even better than the porcelain stuff, but porcelain is stronger and it ages better. And this is why I've got a bit of a preference towards porcelain. Now, as we've got this photo up on the screen, I'm going to show you a step-by-step process of how I did the composite veneers on this one, okay? Because it's not actually a typical way of doing it. Okay, so at this stage, what we have is the implant. This is the implant and this is the crown, okay? And these are the two natural teeth without anything done, okay? It looks like I've probably roughened the surface just a fraction there. You can kind of see the scraping marks on there. But this is as the patient is in day-to-day life. But we wanted to create a bit more of a harmonious look. We wanted everything to blend together a little bit better. And I think in this case, the patient's budget wasn't allowing for porcelain veneers, and that's why we mixed porcelain and composite. It isn't something that I would recommend just because over time they look really different. So here, all we've got is this what's called retraction cord, okay? It's just like a little micro rope that we just place underneath the gum. Okay, this is done without anesthetic, it doesn't hurt at all, but it just separates the gum away from the tooth a little bit and help us define the margin. Then we add this composite material, and composite material comes out, it's basically, if you've had a white filling before, you've had composite. It's the same material. We squirt it out, it comes out in kind of like a putty form. I pressed it on the tooth. At this stage, I don't care what it looks like. I just want it to fit well along the tooth. And then you can just take it off, because this isn't glued onto the tooth at this stage. It's literally just put on there, we press it up against the tooth, and then we pull it off. And this is what it looks like. It's not really that glamorous at this stage. I then take a pencil and I define the margin. The margin is one of the most critical parts of any kind of veneer. It's where the tooth and the veneer meet. If we're ever going to get problems in the future, we're going to get decay around this veneer, it's going to start at the margin. So it's critical that the margins are perfect. So you can see that the front of the tooth here is kind of rough. Okay, this one's been refined a little bit better. I don't know why I drew a 1 on there, but what I have spent time doing is getting all the margins neat and tidy here. Okay, so that's again our first stage. And then we spend time refining the overall look of the tooth. So you can see we're getting much closer to the final product here. And then once we've got the shape of the tooth all correct and we're happy with the way that it looks, we can then glue this composite veneer onto the tooth. Now, a lot of people don't do it like this. I haven't seen many people when I'm going to talks and things like that who are advocating a technique like this. A lot of people will do this directly on the tooth. Okay, so here indirectly means I did a lot of the work on the side. And I feel the advantage of that is that I can get the margins perfect. So what I mean by this is we put the glue on the tooth, we glue the composite directly on the tooth, and then you finish it, margins and the way that it looks, directly on the tooth. I think this is probably a little bit quicker, but we'll never be able to get the margins of the teeth as accurate as they should be. And I think this is the final product here. Okay, from different angles, kind of looks nice. And if she whitened the rest of her teeth, I think they would blend in beautifully. So if we go to what we said our original teeth were like, this is where we're at, okay? There was minimal preparation, i.e. roughening of the teeth here. And you can see the kind of very fine marks of a drill. Okay, so this is the amount of preparation. You can get minimally prepped, which is this, or you can get almost no prep. So this lady had veneers, and I will show you what her before smile was like. Actually, it's not a terrible smile by any means. But this is what her smile looked like beforehand, and we did zero preparation on this smile. Okay, in fact, let's walk through this smile in a minute. But before we do that, the reason that prep is so important is that if you're cutting down a tooth and you're going beyond what's called the enamel is just the outer shell of the tooth, it's the hardest part of the tooth, then we can start affecting the nerve underneath there. And there is a bit of a safe margin, but those videos that you see about people going abroad and they've had their shark teeth done, this is why dentists get so worked up about those kind of treatments, because they're what's called over-prepped. And if you over-prep a tooth, it can lead to it needing an early root canal treatment or additional complicated treatments, and maybe even fractured because it's so weak now. Okay, so when we're looking at veneers, which is predominantly a cosmetically focused treatment, it's a good idea not to kind of reduce the overall health of the teeth. Okay, so that's why dentists make such a big deal out of no prep and minimal prep veneers. Okay, they're super difficult to do, but for the patient it is absolutely the best way of going down this whole veneers route. In some cases, like this one, okay, the veneer could be completely reversible. In other cases that I showed you, that composite where we've done a little bit of reduction, it's not irreversible at that stage, because the tooth which has been removed will never be able to get that back. Another concept to maybe think about is biological cost. And what this means is not just a financial cost of having veneers, what's the biological, what are you actually losing? So this lady had porcelain veneers. We did a full smile design. Porcelain, in my opinion, is the best one, it's the most expensive one, and to get it right, I feel requires a certain process. Now, everyone's process, whether it's with us or your local dentist, starts with a consultation. This consultation is for you as well as for the dentist. I mean, when I'm having a consultation with a patient, especially about veneers, in a situation like this, where she's already got pretty nice teeth and we need to make it amazing, I'm thinking, is this patient crazy? Okay, are the expectations realistic for this patient? But if you are going for consultations, you need to find someone who you get on with, somebody who has an attention to detail if your expectations are high. If all you want is just block white teeth, anybody can do that, that's easy. But I think you should spend time trying to figure out who is going to do this treatment for you, because sometimes there are complications. In fact, this lady, the reason I've got this lady's photos on the screen is because I saw her for an emergency appointment yesterday. One of her veneers had fractured. We're replacing it, but it just brought this case to the forefront of my mind. Now, the way that the vast majority of dentists are taught to do veneers or smile design treatment like this is to take a digital scan. After we take a digital scan, you can have something called a digital mock-up done, okay? And my associate does it very much like this, and he also gets amazing results. And what you look at isn't so much the teeth, you have to zoom out, you have to look at the whole face, you have to get things like the incisal edge. So the incisal edge position is this position here, okay? This is one of the most important parts of the overall smile. Okay, the other one is the midline, and once you've got the midline in the middle of the face, ideally it can be a little bit on left and right, but it has to be parallel with the mid-facial line, and the incisal edge has to be showing enough tooth which is kind of age and sex appropriate. Okay, and what I mean by that is as we get older we show less and less top tooth, more and more bottom tooth, and ladies will typically just show more than men at the same age. So you have this facially driven approach towards having veneers. And then from the digital scan that we have, we will then mock up on a computer screen to kind of plan the treatment, but also a lot of people will show the patient what it looks like. I don't do this because I don't feel it's an accurate representation. Looking at teeth on a computer screen is very unnatural. Looking at teeth on a model is pretty unnatural. So what often I'll do is talk to the patient, and we'll start with a photo like this. We'll discuss how long the teeth need to be, and then we look at the lower lip like this, and we want to follow that lower lip up like that. Okay, and you can see now that these teeth on the side are slightly shorter than ideal. And this was the patient's main concern, was you couldn't really see her teeth, and although we can see them in this photo, it's more when she was talking, her smile wasn't really very visible. And the visibility of the teeth depends, number one, on the teeth themselves, but also the soft tissue. So this lady's got lovely full lips, and we are able to actually push the teeth out, make them look a little bit bigger, a little bit longer, and it's not going to look weird. Okay, so we have to take all of these factors into account. And I believe there's only one way of doing this properly, which I'm going to show you. But let's get back onto like how general dentists will do it. Then from the digital mock-up, they'll have a model printed. That model can then transfer a temporary set of teeth into the patient's mouth, and this is the trial smile. So we'll even my method will get to this stage, but we do it differently. Basically, I don't do any of the digital stuff at the beginning of the treatment. I will just hand make a full set of temporaries. So let's have a look. Okay, and these things here, these are composite attachments. This lady had Invisalign before she came to see me. She was getting towards the end of it. She didn't like the results, and that's why we started looking at veneers. Okay, and this is her trial smile. So this is a kind of like a mock-up of what I think the end result should look like. Okay, and at this stage we have not picked up a drill and touched the tooth. I've drilled the temporaries loads to get to this stage, but we haven't adjusted the teeth. So at this stage we are 100% reversible. And also for this lady, the final veneers didn't require any adjustment at all. Now there's a number of things which make teeth look natural, okay, make a smile look natural, even though this is all one big block. It doesn't look like that, and that's because we have this little V-shape notches in between the teeth. Okay, so if you look at a lot of smiles, you'll see that this isn't that common if you're looking at kind of veneer smiles, and this is one of the kind of giveaways. Apart from some people just have their teeth too white, one of the giveaways that something is fake is you lose these V-shaped notches, and as we go further back, these notches get wider and wider. So at the back here you can see it's almost 90 degrees, and at the front here it's much smaller. It's a much smaller little notch there. Now there's probably about 20 or 30 things about smile design that I can talk to you about. I've already talked about the incisal length, the midline, now these little V-shaped notches. But I don't want to make a whole video just on this. The whole temporaries, right, it's not about getting into the micro details, it's about achieving a nice overall looking smile. So at this stage, we're at a smile which I think looks nice, and sometimes the patients had anesthetic as well, so their lips are all over the place. You can't really tell if the smile looks nice or not. So the patient goes home and lives with a smile for maybe a week or something like that. And then if there's anything that the patient doesn't like at that stage, we have the opportunity to change the temporaries as much as we want to. And we get to a stage where both myself and the patient is happy with the overall look of the smile. And if there's any limitations in what's possible, that's discussed at this stage, because sometimes there is. And now comes probably the most critical part of any smile design veneer treatment. We've made a set of temporaries which the patients love, and we need to replicate that into porcelain. And this is the job of the dental laboratory. I've worked with so many dental laboratories over the years, and so many of them are moving towards digital technology. So scanning in the teeth, designing the final restorations all on a computer, having a computer mill these restorations, these veneers, and then they add a little bit of surface texture. This is almost the opposite of how it used to be done 10-15 years ago. Again, during your research, you might come across terminology like Emax veneers or felspathic veneers. Felspathic are completely handmade. Hardly anybody makes felspathic veneers these days. But even Emax, you get milled and you get pressed, and each has their own advantages and disadvantages. The lab technician, Enzo, who I'm working with for Veneers now, he does it all himself, and he incorporates a little bit of digital into his manual workflow, and I'm finding this works really, really well, because you get a hand-finished porcelain veneer, okay, and they look amazing. The thing with veneers is our patients are doing this to improve the look of their smile. They're looking for something a little bit special. Whereas if you're just having a white crown at the back, the aesthetics are not that critical. So we can use digital technologies to help speed things up and improve kind of turnaround. But this is a complete bespoke solution. It's slightly different. Okay, so that's kind of the process. I hope it's kind of cleared things up a little bit, but I've just shown you cases where people already have okay teeth and we need to just resurface them and add these minimal preparation veneers over the top of them. This is the minority of cases. Quite often we'll do much more complicated things, combining implants with veneers plus crowns and onlays and all this kind of stuff. And these days there's not a clean differentiation between all these different types of what we call porcelain restorations. A veneer is basically a crown which only covers the front of the tooth. Now, if you've got a very complicated situation like this or this, for example, it's going to require much more thinking and many different kinds of treatments. But the process is still all the same. We start with a design in our head. Sometimes we can make a digital mock-up of this design. We transfer this into the patient's mouth so they can visualize what the end result is going to look like. And only once we're happy, that's when we proceed to make our final restorations. And sometimes we need to make all the teeth slightly different colors. Okay, imagine we've got a situation like this and we need to make the final smile look even. Well, this tooth is much darker than this one. So we're going to need to think about what we can do to get the color exactly right. So in my next video, we're going to be talking all about the color of smile design and veneers and how to make a smile look really, really natural. I'll be deep diving a little bit more into the aesthetics and stuff which we spoke about on the video as well. So be sure tune in for that one. Remember to hit like, please subscribe if you like this kind of stuff, and I will be with you soon. I'll take care.